All right. So, what are the limitations and risks I want to talk about as we plunge in here? One of the things I want to point out, we can never completely eliminate anxiety from human experience. Our clients are going to continue to experience anxiety. In fact, guess who keeps experiencing anxiety? Me. I'm an anxiety expert, but I know anxiety is going to be part of my life because it's part of the human experience. And one thing we're going to try to do with our clients is help them develop some tolerance of anxiety and of stress. Stress and anxiety are a normal part of life, and we don't want to consider ourselves as capable of getting rid of it. So one of our limitations is to say when we're treating anxiety, we can't obliviate it. We can't get rid of it completely. It's part of our experience. But if we understand it, we can increase our tolerance for it, knowing what it is and what it's supposed to be doing for us, but also knowing some ways to manage it. I would say manage is a better word. Now, if there's a person who has difficulty with reality testing, for example, they have some psychosis and they're not sure what is reality or not, it's going to be difficult sometimes to help them recognize that anxiety sometimes is out of proportion to the real dangers. You need to have some decent reality testing. But you know who we have in our practice? People who say, I realize it doesn't make sense for me to be afraid to ride in the car with my sister. But I'm afraid to ride in the car with anybody right now. And I realize it doesn't make sense, but it's how I feel. Now, how do I deal with that? Because I panic when I get in the car as a passenger. See how that person has some reality testing going. They realize I know she's a safe driver. I know that I should be able to get into this situation. So there's some other things we need to realize. We have to be ready to troubleshoot some problems that come along with treating anxiety. You know what a big problem is? People have trouble sleeping. And that difficulty with sleeping is something you should recognize as a normal part of dealing with anxiety. People who are anxious, they don't have an easy time falling asleep. So part of treating anxiety is often treating sleep problems. And so CBT for insomnia is one of the very best things to know if you're treating anxiety. And another limitation we sometimes face where if we don't know how to treat insomnia problems, difficulties falling asleep, difficulties getting back to sleep, right? Okay. Now, exposure is one of our most powerful treatment methods, but not everybody's trained in it. And if you do exposure improperly, you can make anxiety worse. So once again, there's a risk. You can get trained in doing exposure, EMDR kind of techniques, but you need to know what you're doing. So these are the kind of limitations you need to consider as we approach this process. Okay. I'm going to start out with a word I want you as a therapist to know. This is not a word I share with my clients. It's a confusing word, but it's so helpful for us. Neuroplasticity. Neuroplasticity means we can change our neurons. We can change parts of our body made of neurons, like our brain. We can change the brain. And neuroplasticity is actually a tool that we've been using for years as therapists. We just didn't know exactly how we were doing it. We knew we were changing people's thoughts. We knew we were helping people change their emotions, but we didn't think of it as changing neural pathways, but we were. And so neuroplasticity is our friend. Neuroplasticity is a therapist tool. So when we try to change how a client responds, how they take a situation where they feel some anxiety, how they react to that situation, we are trying to change their thinking processes. We are trying to change their brain. So changing how a client responds is not just about, we're going to change how you respond in this situation, and that's what we're focused on. No, we are actually trying to have them change in that situation in order to work on changing the pattern that their brain follows. We're trying to train new behaviors. And that depends on neuroplasticity, the ability of our brain to change. And it can, but you have to know how to do it. And so our goal as therapists, which we've been doing all along, But now we have the ability with fMRI and other techniques to be able to actually see it happening. Our goal is to change the way the brain responds, change the way we create emotions, change the way that we prevent ourselves from creating an emotion, right? I'm not going to go down that pathway and create that emotion. Change the way that we think. That's changing the way our brain is operating. And so we want to help our clients see that they can change the brain. So I'm telling you this word neuroplasticity, but I don't say it to my clients because it's confusing. We're going to talk about ways we explain it to clients. Here's the key knowledge about the amygdala that I want you to start with. First of all, if we can help our clients understand the language of the amygdala, understand how the amygdala communicates to them, understand where they see it in their behaviors and their emotions, right? We can help them understand the experience of stress, the experience of anxiety, this terrible experience, one of the worst in the world, of panic. And we can help them, even when they experience some anxiety, to say, I know what's going on here, if you see it as part of the language of the amygdala. Now, the other things that we know is, how does the amygdala learn? You know how the amygdala learns? I hate to tell you, because it's nothing that we say, nothing that we talk about. It's the experiences, the vivid experience, things we put a person through, like getting into a car with their sister. The experiences that a person have, those are the way that we can change the amygdala. And the amygdala learns through experience. And once you tell the client that, once you explain that, you have to have an experience to teach the amygdala that riding with your sister is safe. Then they say, oh, they approach the situation a little differently. And how about the cortex? There's some knowledge about the cortex that we need to pass on to our clients. The thoughts that you have and what you sit there thinking about and what you imagine, those contribute to the creation of anxiety and stress. The way that you think is going to influence the kind of stress and anxiety that you have. So if we tell a client, we're going to work on having you understand ways to control the anxiety that's produced in your brain, that is sometimes about the thoughts and the images that you are creating, sometimes deliberately. Sometimes you are deliberately worrying, right? Sometimes you are thinking thoughts that definitely activate the amygdala. And so if you can weaken certain thoughts and strengthen other thoughts, you are going to be able to affect your stress level and your anxiety level. And one of the key things we want you to do in your cortex is to come up with goals in your life that are based on your logic and your preferences and your values and your interests that are in your cortex, and not let the amygdala decide what your goals are. Because the amygdala is trying to keep you safe. I get it. But guess what? It doesn't always know whether something's safe or not. It always acts very conservatively to protect you. So let's look just for a minute here at these two parts in the brain that I'm talking about. First of all, notice that the cortex is this curved part of the brain, and it's not really in these pretty different colors here. It's really kind of all gray, but it's divided into these lobes. This curved cortex is the largest part of the brain, and it's the part when most people say the brain, they're thinking about their cortex. That's something we're going to be talking about. But we're also going to be talking about this small part right here, about the size of an almond. There's actually two of them, one on the left side, one on the right side, deep in the center of your brain here, underneath the thalamus here, that little amygdala there. That amygdala, the two of them on the left and on the right, those amygdala are going to be very important to understand what they're up to in there. All right. So when I give you information about the amygdala and the cortex, I'm trying to give you information that's going to promote engagement. It's going to promote motivation to have our clients do the things that we want them to try so that they can change their brains. And we have to connect their concerns And their questions, especially questions about why do I feel this way when I get in the car with my sister? Why do I pretty much have a panic attack the minute I sit in that passenger seat? We want them to ask us questions so that we can tell them what's going on in the brain. We're going to explain how the amygdala is creating these reactions called the fight or flight response, and how it blocks some of the goals they have in their life, just like being able to go to the mall with their sister in the car, right? And what we're going to want them to do is to be able to start being more mindful about those reactions. And when I say mindful, I mean instead of getting caught up in the reactions, we want to help them be able to kind of stand back and say, now, yep, look, my heart's starting to pound, my mouth's starting to get dry. This is the amygdala again, isn't it? It's starting to produce that fight or flight response, the stress response in me. And we want them to be able to experience that and not get lost in it. Now, I want to tell you what I'm going to do today is not what I want you to do with your clients, because I am going to present a lot of neurological information to you in this 1 3-hour session. You should never do this to clients. You need to introduce it gradually. In fact, I don't mention the amygdala at all in the first several sessions. I just let them know that the brain creates anxiety, and I know how that works. And I want to explain to them how it works so they know how to change it. And it just gets their curiosity up. They're like, what is she talking about? I want to know about this. Here's the thing that is true. Of all the disorders that we treat, including depression, which we're pretty good at treating, but we really don't know even where it is in the brain. Of all the disorders that we treat, whether we're working with bipolar disorder, depression, autism, schizophrenia, we know more about the neurological underpinnings of anxiety disorders than any other disorders. But are we using what we know about those neurological underpinnings to help our clients work toward their goals? That's what I want to give you the power to do today. And I want you to remember that I'm not trying to turn you into any kind of a neuroscientist. I'm just trying to tell you where stress comes from so that you know how to intervene and help the client know how they can change things. But through this whole process, it's essential that you do not stop being a therapist. You need to remember that what you're doing is you're trying to create a process of change with your clients. Your goal as a therapist is to say, we're going to work toward some changes. And we want to get you back to living the life you want. We want to empower our clients. That's what it is to be a therapist, to say, what is it you want to accomplish? Because I'm here to help you do that. I'm here to help you do it. And I want to have you not get lost in your anxiety. I want you to kind of step back from stress and anxiety and see them in your life and understand them. And this is going to increase your client's motivation, feel like I'm going in to get coached into how to change my brain and make it stop producing this anxiety, make it stop creating so much stress. And they have so much more hope. And I want you to help them understand the reasons that we give them certain homework. We tell them to do something because it's going to be about teaching the amygdala. And we're going to really try to create a new perspective where instead of just experiencing their feelings, they know what is underpinning and underlying them, and they get more involved in watching those experiences.